I think and I'm going to go through this quickly because I think a lot of the things have been covered already, but I just want to put it in a framework. And I think Dr. Bernard's last slide about that paper that a bunch of neurologists and geneticists together worked to combine is a good segue, because I think it's important to think about treatment, not just in the context of actually a curative treatment, but also in supportive treatment, right? And so, in pediatrics, we think a lot about a concept called anticipatory guidance, right? And, if you have, many of you have healthy siblings here, you bring a child to the pediatrician to know, like, okay, now they're going to be teething. Here's what to do. Now they're going to be walking around. Now it's time to put plugs, cover up all your plugs so that they don't get hurt. At some point when you have teenagers, oh my gosh, what's going to happen now with puberty? These are all things that doctors and families are used to working together on. And then I think those same metrics and those same guidelines really need to apply to a child with a special rare disease too. But unfortunately for the families, very often the doctors that you're working with don't have that same. Okay, it just needs to work for a couple more minutes. Don't have that same framework, right, for being able to provide you with the guidance you need. And so you need to come in with that map, which is really a hard place to be, because not only are you having a child who has more significant health concerns than the majority of children, but in addition, you need to be sort of running the shots, right? And so I think that one thing to understand is that it's important to be informed and know what questions to ask, because your doctors may or may not think of those things, right? So I wanted to go through at least sort of a list a little bit, and a lot of these things have been things that have been touched on, but just these are the health concerns that you need to ask about when you go in, because these are the things that we can anticipate already at this time are going to be problematic. And, our hope is that this type of supportive care can, make people more comfortable, healthier, and more amenable one day to other therapeutic approaches that we hope to bring to the table. And right now are really a very important part about our approach. And, there are people who have rare disease who have already been significantly helped. So, for example, in cystic fibrosis, there is still no curative treatment, but they have dramatically changed the lifespan and the health and well-being of those children just through reasonable, sensible management of care, right? And, of course, we need to do more work through natural history studies to better understand what things to anticipate when they're going to become problems, because we just don't have enough data yet, and we're working on that. But I'm going to talk briefly about things we already know about. So, first thing is that, being upright in whatever way or format can be done is, incredibly important, right? And, part of it is just fun. It's more fun to approach the world from a seated or a standing position, but there's an immense amount of it that's also part of bone health and overall health of your organs. We are meant to be upright beings, so all our organs inside us are arranged in such a way that they work better. Our bladders, our lungs, our kidneys, all of us work better if we're mobile and we're upright. So everything that you can do to approximate that functionality is important, and is important to long-term well-being. So in keeping with that, we know that children who are not as mobile and who are not as upright and weight-bearing are more likely to have fractures, more likely to have bone problems. Again, this is a long-range game, right? So thinking about things like osteoporosis and making sure that your doctors are checking, vitamin D levels and calcium levels, and making sure that people are thinking about that some medications might affect vitamin D levels and the ability of the bones to build calcium. Those are all important things that may fall, get swept under the rug in the face of all the big, important complications that children with TUBB4A can have. I think the concept of working with your rehab doctors and your physical therapist and your occupational therapist to maintain weight bearing in whatever format, as close as possible to typical, that is appropriate for the function of that child, is important, and not to think, oh, well, it's lower than everything else on the to-do list, and so let's not, or the child doesn't like to be in the stand, or, all these other reasons that we use. And I'm saying that from this super, ridiculous situation that I don't have to put a child in a standard every day, so I'm not trying to minimize how difficult it can be, and I'm not trying to simplify things, but I just want to say that, again, this is a long game, and these little things are important and cumulative and add up to health and well-being over time. And I think it's also important to have involved in your team, an orthopedic surgeon and a physiatrist who can help you manage and anticipate complications, and think about, hips and think about spines, and also to make sure that those teams have reached out to people who are familiar with the disease, because a lot of orthopedic surgeons, and physiatrists, through no lack of good intentions on their part, see the word leukodystrophy and assume certain things about what that means about a child's longevity that are not actually appropriate to TUBB4A, and so may be making decisions based on lack of good information about the long-term longevity of whether or not it's appropriate to address hip subluxation, and whether or not it's appropriate to think about spine repair and things like that. And so I think that making sure that your local teams who have a high amount of technical expertise in doing these things have the right context and background information with which to make those decisions and to help guide you. I'm not going to talk a lot about things like tremor and dystonia and spasticity, because Dr. Bernard just did a better job than I ever could, but it's just, again, important to work with your local team to make sure that they reach out to people who have done this before with patients with TUBB4A, and not just assume that this is how the child is going to be, because it can have an immense impact on comfort but also on overall well-being. Another thing that's important is that, and I've talked to some of you about this, is that it is our impression overall that seizures are not that frequent in TUBB4A, and that a lot of things that get mistaken for seizures are actually very severe movement disorders. And I think that that's an important thing to make your doctors aware about, because that way, when there's an event that happens that can sometimes appear very, very much like a seizure, right, they can understand that they have to do more than the typical due diligence to look at EEGs, try to capture the event, and make sure that it's a seizure, because even if sometimes these events can respond to certain seizure medications, because we know that certain some medications that are used for seizures also work for some movement disorders, that doesn't mean they're actually seizures, and that especially if they're not responding, before you add a second and a third and a fourth seizure medication, that can have other impacts on children's well-being and alertness and health, that we really think and dial down to, what is this? Is this a movement disorder? Do we need to think about it and treat it like a movement disorder? Or is this actually a seizure, and do we need to treat it like a seizure? Because those are two very distinct pathways from a treatment perspective, and I think it's very important in TUBB4A specifically to have clarity on that. We talked about nutrition. I can't overemphasize how much all the things that Donna, and as we're all sitting here hungry for lunch, how important nutrition is, because it impacts everything else. It impacts your ability, a good nutritional status impacts your ability to fight off that lung infection that you might be more likely to get because you have scoliosis and because you're not using your muscles well to breathe, right? It is the building block of every other aspect of health. And so working closely with your swallowing team and with your nutrition team to make sure that that is working well will overall affect skin repair and integrity, lung integrity, everything else downstream, to make sure that your kids are healthy and comfortable. And just to reiterate what Donna said, is that, nutrition options and feeding options are not you eat by mouth or you have a feeding tube. There is everything in between, and making sure that you use that entire spectrum of options and opportunities so that you're getting the right fit for your child at that time, and not thinking about things in a binary fashion of either I'm going to do everything by mouth, or I'm going to do, in a neurotypical way, or I'm going to do everything by tube, but that there's all kinds of adjustments and accommodations that can be made to positioning, to the way food is presented, to the time food is presented, and everything in between, to a child who can only tolerate, foods through a G-tube. And to just think about that in a broad way. And I'm not going to reiterate this because this is stuff that has been talked about already, right? I guess I do want to say one other thing, just I think specific to TUBB4A, is that just like your children can have abrupt changes in tone and abrupt changes in movement, think about the swallowing as a muscle that can also have abrupt changes in tone and function. And so be thoughtful about the fact that at different times of day and with different levels of stimulus and triggers, swallowing can abruptly change, right? And so even for children who are swallowing very well, to think about the fact that that could become a problem abruptly, and so to think about things that are known choking hazards, in what I always say is known choking hazards in toddlers, right, are things that should not be used and given to a person who has potentially dystonic swallowing, right? Because we have heard stories that we don't want to hear about people abruptly choking on things. And so for people who are still swallowing well, be sure that you're not presenting things that are known choking hazards to toddlers. popcorn, hot dogs not cut up, grapes and cherry tomatoes not cut up, and hard candy and nuts and things that are just sort of common sense things. If you would not give it to a 2-year-old, please don't give it to a patient with a TUBB4A-associated leukodystrophy. I think also that being thoughtful and anticipating the fact that there might be more challenges to lung function in a person with TUBB4A is important. So thinking about the fact that if you have a spine curve, your lungs are not living in a space where they're functioning in an ideal way, that if your muscles aren't as strong as they should be, that if you are not well, you haven't been able to get good nutrition, all these things are going to be things that are going to make you more likely to have a significant lung problem. I think that it is better to involve pulmonologists early and often, right? Because we know from data across the leukodystrophies that one of the number one medical problems is, lung problems that make children with leukodystrophies be in the hospital and be really sick. And so we want to make sure that we prevent those things. And I'm just going to make another, there is no reason from a medical perspective, there's no additional risk for a patient with TUBB4A at getting the flu shot. And there is a lot of data that says that people who have neurologic disability should get a flu shot. And I know that there's different cultural aspects of that across different countries, and that different places think differently about the flu shot for their overall population, but for a child with a significant neurologic disability and no underlying reason why they might be more vulnerable to the immune trigger of getting a flu shot, people should really think hard about getting flu shots for themselves and for their family members. I want to talk briefly about sleep. Sleep can be really complicated, really difficult. We haven't touched on it at all today because it's a really complex subject, but don't be afraid to talk to your doctor about sleep. You're not going to have good function during the day if you're not sleeping well. And that also stands for families, for parents, right? Caregivers also need to get good sleep. So sometimes if people are not sleeping at home, you need to really think about medications and things like that to help with sleep because it just has such a profound impact on the way everything else happens in the family life. So if a child has really significant spasticity and it's not well treated and the person's not sleeping and mom and dad are not sleeping, nothing is going to go well in the family's function, right? And so I think that it's also important to think about breathing problems in the context of sleep, and that sometimes lack of sleep can mask actual problems with breathing, and to, again, speak to the pulmonologist about that. And then also to keep in mind that there are things we don't fully understand about sleep and brains in leukodystrophy and across. I heard from several of you during this conference that your children are tired during the day, even though there's no good reason for why that's the case. We've seen that more clearly in some of the disorders where we have a lot of teenagers like 4-H. And I think that in some cases, where really everything has been looked at and sleep is really going as well as it possibly could, to think about that if children are missing out on things, that there are medications that can help with vigilance to allow them to participate fully in activities during the day. GI constipation and vomiting, I think things that Dawn and others have already talked about, and these are probably something you hear about a lot, but don't minimize the effect of constipation. It can make a lot of other problems worse, including set you up for urinary problems and more spasticity and discomfort. But think also about the fact that when your brain does not work in a typical fashion, nothing else from your mouth to the place where things come out is going to work in a typical fashion. Above and beyond that, we have also begun to see emerge some themes with chronic vomiting in some patients with a TUBB4A-associated leukodystrophy that we do not fully understand. But if you're experiencing that, that is something that other friends in this room and outside this room who are in your groups with TUBB4A-associated leukodystrophy are also experiencing. Although it's not something we have a real understanding and solution to, I just at least want you to know that we think that that might be part of TUBB4A-associated leukodystrophy. UTIs are an often hidden cause of problems that are one of the major causes of hospitalization in children with leukodystrophy. There are things that are setups for getting UTIs. Those include constipation, right? Those include challenges with toileting because of mobility issues, and can be a really significant contributor to lack of quality of life. And so, different people have talked to me about prophylactic antibiotics, about seeing urologists. These are all things that are important also to pay attention to. And if toileting is not happening well, and if you're seeing children go long periods of time without peeing and then have a lot of peeing or have discomfort with peeing or need to pee and then pee again and pee again because they're not able to empty their bladders completely. Those are all reasons to ask to see a urologist. Very often people don't think with a child that they might need to see a urologist. We all think only elderly gentlemen need to see urologists. Children with leukodystrophy often need to see urologists too, and it can prevent them from having infections. Some of the models that we've been looking at really clearly show an abnormality in the optic nerve. So I think it's possible that in some cases vision is impaired and difficult in TUBB4A-associated leukodystrophy. In addition, people with TUBB4A-associated leukodystrophy often have eye movement abnormalities that can make it even more difficult to use their visual world. And so I think working with a vision therapist to make sure that they have the best possible access, that especially things in school are adapted to their visual function, is very important. We also have a very small percentage of people with TUBB4A-associated leukodystrophy who seem to have hearing problems. Again, I don't fully understand why that is, but just keep that tucked away in the back of your minds as a potential challenge. And then I think other important things is to remember that children with TUBB4A are also children and adolescents with age-appropriate humor, interests, and concerns. And so to think also, especially as puberty gets in and as children age, that the kinds of behavioral things and the kinds of interests and worries that you might have in a neurotypical child may also become problematic, but might be harder to uncover and understand in a patient who has the type of profound communication and mobility difficulties that your children may have. And I also think it's important to know that they're part of families who love and care for them and who are profoundly impacted by their diagnosis. And so thinking about, and I know you all know this, but it's just important to say that self-care is important, that psychological support for the different family members is important, that respite care is important. All these things are important. You are all superheroes in my mind, but even superheroes need a break. And so, take advantage of whatever resources and infrastructure there exists in your community for supporting that aspect of your life. And then a final thing is that children with TUBB4A grow up, and so there are legal and financial ramifications to that. And to think early and often about what that means for your family and implicating, especially as children become teenagers, the appropriate legal infrastructure in your country so that you can maintain appropriate legal guardianship. And especially in the U.S., there are very sort of odd laws where somebody becomes, who's been profoundly, who has not had the ability to establish a kind of independence you would expect from a teenager. All of a sudden they're 18, and if you bring them into the hospital and a doctor does something in a position where they're not able to give consent, that's actually assault, right? Like, we can't do things. And so to think about involving the appropriate legal entity so that as people grow up, you have the right legal framework to continue caring for and supporting your children in the way you're doing is actually important, and not something that should be done, at 17 years and 355 days, because that's when people start thinking about it, and often that's a little bit late to put in place all the appropriate infrastructure. Okay, so those are my sort of things about anticipatory guidance across the lifespan for TUBB4A, and we are going to segue now